Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Hafa and welcome back, everybody. You are watching Healthy Living Tuesday right here on KUAM. Now, you may not know that prostate cancer is the most common form of cancer in men. Typically affects gentlemen over the age of 50. So Dr. Jitka Lom from Express Care is here once again to educate us on how hopefully we can understand the disease and do things to hopefully steer clear of it. Okay.
I'm here.
Yeah, so Dr. Lom, prostate cancer, as we said, affects men. Why does it affect men in their older years, and why typically more men?
Well, you know, women don't have a prostate gland, so men are affected by prostate cancer, and it's a disease of elderly people in general. Over the age of 80, on autopsies, over 75% of men will have some prostate cancer actually in their prostate. It hasn't really bothered them until, you know, at all in their life often. They didn't know they had it, but if it comes at an earlier age, sort of in their 40s or 50s, then it can be life-threatening. But prostate cancer is extremely common. Like I said, usually not causing problems as far as like a cause of death, unless it comes to you at an early age, which is why we do screening.
Now, because it does involve the prostate, and the prostate's only in men, what function does the prostate serve in the male body?
Great question. And where is it? So you're actually sitting on your prostate gland right now between your bottom end and your private parts. It's sort of right in the middle. And that's your prostate gland is there. And what it does is it produces different kinds of lubricants and solutions that go through the urethra, which is the tube that goes out of the penis along with the semen or urine. So it's basically a gland that produces different liquid that helps everything be sort of lubricated on the way out. And so because it's a gland, it sits kind of around the urethra. The urethra is a tube that goes through it. And if it gets very large, as it tends to in older men, the prostate will get enlarged and it can start pinching the urethra. And when it pinches the urethra, then people have urinary problems in later life. So typically older men will have problems with their urinary stream, meaning their pee-pee isn't quite as steady or strong as it used to be. They may have to get up many times during the night, and they may even have problems even going at all, you know, as that thing gets bigger. And that's a very common thing. We call that benign prostate hyperplasia. That means that the prostate is basically getting bigger, BPH for short. That's different from prostate cancer. Prostate cancer, the gland can be nice and small, but it's got a little piece of it that is malignant, meaning cancerous, which can also spread and kill the person. So there's those two conditions that older men will suffer from.
Now, we hear so often that men, is it approaching the age of 40 or the age of 50? You know, that seems to be, you know, the magical number, you know, for lack of a better term.
Around
you have to get
age
a
50.
colonoscopy.
Colonoscopy will tell you about the bowels, meaning about the large bowel, the colon, okay? That's where the poo-poo is. But this one is, prostate is around the urethra, meaning where the urinary tract is, where the semen comes through, all of that. So they're two different areas. So colonoscopy you should do when you're 50. When you're 50 as a man, you should have what's called a digital rectal exam, something that everybody dreads, but it really isn't that bad, where the physician or medical provider puts just their little tiny bit of their finger, not the entire finger, just a small piece of their finger inside the bottom end, and feels around to feel the prostate gland. And when we do that, we are very gentle. We use some lubricant. It's not horrible. And we just feel the prostate gland. It should be very smooth, sort of feels like maybe the tip of your nose, something quite smooth and firm, but not hard. And when we feel it, if we feel something that's like a hard lump, sort of feels like a stone or like an earring or something like that, something very hard, then we know, oh, that's a nodule, and then we need to go get that checked. And the way it gets checked is with an ultrasound, where again they put a probe, again just a little bit bigger than a finger, up the bottom end, and with that probe they can see the prostate gland, they can see nodules there, and they can also insert a tiny needle through that and do a biopsy and take a piece of that tissue and send it to the lab and find out, is that a nodule that's prostate cancer or is it something benign?
And to be fair, medicine has advanced and medical practice has advanced, because I remember this procedure was done with people that are typically in their older years. Nowadays you see they make that like as part of a routine physical checkup, right?
Well, Again, the guidelines for screening for prostate cancer are from age 50. Okay, every few years after the age of 50, you should have a checkup done where the physician uses their finger and feels it, and that's really, really important and not something to be shy about. As far as younger than that, only if you're having some kind of symptoms, like if you're having pain or you have a strong family history, maybe start at age 40.
Okay, well, we do have some interesting questions relative to this, because obviously this is something that people are very concerned about. So stay tuned, because we will be right back